Well, our children's hospitals are overwhelmed with patients. Doctors don't want to alarm you, but they want parents to be mindful about their kids and the three viruses going around right now. Tonight, some of our local hospitals are nearing capacity, and the staff is working tirelessly to help. Laura Queso reports.
Infections are spiking across the country. We knew it was bad, but in the last 3 weeks, doctors say it's only gotten worse. RSV is the most widespread among children, then flu and COVID.
They are higher right now than they usually are this time of year.
Dr. Ethan Leonard, chief medical officer at UH Rainbow Babies, says the hospital is currently at 95% capacity. The majority of those 200 plus kids are there for respiratory illness. For perspective, around this time, they are usually at about 80% capacity. I'm told hospital staff has expanded intensive care by creating new space.
What's going on right now kind of takes us back a few years to the beginning of COVID, which is, if you can avoid getting into enclosed spaces with lots of other people right now.
At Cleveland Clinic Children's, the positivity rate is 37% for RSV in children 0 to 5 years old, the most at risk.
You have to see and take care of that patient just like they were your own. It's hard, it's tough, it's physically and mentally exhausting at many given times, given the high, enormous disease burden we are seeing around us.
And with the holidays on the horizon, parents are wondering, what should I do? Hear it straight from the doctor.
I think it's okay to inquire as to if you're going to a dinner, whether anyone has colds or not, because some of these viruses in an older person may simply be a cold. But if you have a young child, particularly an infant, these viruses obviously can cause more significant respiratory infection.
And what about travel?
I wouldn't encourage people to be flying with young children right now, particularly given that there's not a mandate for people to be masked on airplanes at this point.
Doctors say hand washing is crucial. Don't socialize your child if they're showing any signs of sickness. Don't ignore the signs, get vaccines, and call your doctor with any concern. Respiratory distress means your child needs medical attention right away.
It's overwhelming right now in so many ways. Remember that whoever you are seeing in terms of providers and physicians and APPs and nurses, the healthcare system is also hurting.
Laura Queso, 3 News.